All right, yeah, thank you. Thank you for having me, and thank you for your time today. Your time is valuable, and hopefully you'll find some value in what I have to share. I think my story is really, I guess that's just really what it is my story. It's kind of an unexpected path. It's actually changed the course of my career. I call it my second career. It was unexpected, but I think it fits me better. It's more entrepreneurial, it's more adventurous. And but I had somehow, and I even had a construction business through school, but I had found myself in industry working for employers as a HR leader. And I would say maybe not the stereotypical HR leader, and there's always those in the bunch, right? But someone who's always driving change, and my passion really is to help people. And so I think that's maybe coming through in everything I'm still doing today. So let's jump in. So the focus of today, I want to share the employer story at Merrill Steel, but just a few things that lead up. So just a little background. I'm kind of wearing several hats today, which fits me well. And developing a plan in Texas called the Rise Up Plan, and just recently became the executive director of the FMMA, which I think really fits just my natural style well. I love to encourage, I love to connect, I love to encourage others and build others up, and build and be innovative and build something that doesn't maybe even exist today towards solutions. Also had built self-fund health in the past, but really, I mean, overall, I think my lens that I see the world through is an employer lens. I did that for almost 25 years, and that's the lens that I'll probably speak of the rest of my life. I've got a couple books out there. I had wrote a book called Save Your Company, Don't Feed the Beast. If you haven't read it, it was really difficult to write, but I'm glad I did it. And in July of 23, that came out, and it really sparked a kind of a tour almost. I've been to, I think this is like the 43rd city, and so very fun. I'm getting to see lots of different places and meet great people like yourselves, and just you can send me an invite on LinkedIn, but would just love to connect with you. And I've met people all over the nation. I go to DC next week. I've never been to DC. I'm going twice this month, and it's just, I kind of smile. I'm like, wow, what's happening here? From Wisconsin, been there about 19 years, and you can see I've even made an emoji cheesehead. So I can tell you're not very impressed. I was pretty proud of that. Maybe I should trademark that or something. And then so we'll dig into the story of Merrill Steel and all that came from that. Let's see. So just one more fun. I always try to do something personal in the talks. As the interesting thing about healthcare is that we may be working in healthcare in some facet, right? But we're all also patients. So healthcare impacts no matter what we're doing as a career, every single one of us. So my wife and I, we will be celebrating our 30th in March, and we're foster parents, and we have 4 kids of our own, 4 bio kids, or as I sometimes call them, homemade. But Grace is here, and I promised not to embarrass her, which I probably just did. But my youngest, who is 17, was graceful enough to come with me on the trip. So thank you for that. We're having fun. This is a beautiful area. And then this little guy is Noah. We've had about 30 some kids. We've carried 7 babies out of the hospital like they were ours, but they weren't ours. And so he was our first to adopt, and he's taken a very strong liking for fishing. And so we've been doing a lot of fishing this summer. And in fact, I shared a joke with him, which is now his favorite joke. He said, this is my secret fishing spot, and it's so secret even the fish don't know about it. And so that's what he tells everybody. But he's, and on they called a muskie a fish of 10,000 casts. He caught a muskie on his 7th time fishing. And now he's caught 2, and that was last fall, and then he caught 1 this year. So I think maybe they're both in there, at least one of them, yeah, they're both in there. So he's hooked on fishing, no pun intended. But I thought I would kind of start that off, what if fishing and healthcare, or if we look at from the perspective of the employers, right, the primary payers of the commercial side of healthcare, what do they have in common? And so one of the manufacturing companies I worked for and learned a great deal way back in Kentucky was Toyota Motor Manufacturing and their flagship plant, 3,000 cars every 24 hours, pretty amazing, and cars that would run 300,000 miles and so forth. But one of the things Toyota maybe isn't known is that most of Toyota's innovations in developing what they called the Toyota production system weren't their own innovations. They were borrowed, right? They would borrow best practices from Ford and borrow best practices. Somebody go into a grocery store and they'd say, wow, first in, first out, right? You can't put the new bread in front of the old bread spoils. So simple things like that. And so they take that back, and that developed into a best practice system. And that's really what we do in fishing, right? So anybody like fishing in here? Yeah, pretty cool. I'm not like into it too deep. I don't study barometric pressure or anything like that, but there are some things, that we naturally learn. We'd say, well, this lure tends to work right, this color works well, or this other lure tends to work well. Or we talked about the fishing spot. Where do you go when you catch a fish? Do you ever go back there? You probably catch more fish. And even most of the fishing records are on 3 days on either side of the full moon, if you didn't know that. So whenever I see a full moon, I'm thinking fishing's probably better before the rain or during the rain, but not after the rain, et cetera. But what we're doing is really compiling best practices and saying what's working, what doesn't work, and then we're going to accumulate that into our overall process. So I thought I would kind of make it fun here too, in that I would share 3 aha moments as the focus of this talk. Let me set the table with this. So if you're not aware, what is the market size? How big of a deal is commercial healthcare? Commercial being the non-government. So government's roughly half, Medicare and Medicaid. The other half is commercial, and 2/3 of those employers on the commercial side are self-insured or self-funded, right? They still have stop loss or reinsurance on the top, but they're taking more of the risk and more of the gain if their plan runs well. And often, by the way, we talk too much about even, right, you might say fully insured, or we say we're self-funded, or if you've heard somebody say, we tried self-funding and it didn't work, that's really, there's something missing in that statement. Because it's important. Self-funding is the chassis. It allows you flexibility to reshape your plan and to manage your plan, but how you spend the money is just as important. We need to talk about that too, right? We need to shop for value, as some have talked about already, and we need to reshape our plan to allow that, to enable that. And so Americans are great at shopping for value, but their hands have been tied within the structure of the majority of health plans. So the first aha moment was at Merrill Steel. We had insourced the custodial. We were spending around, I forget, $50,000 for like a person for like 4 hours a week for cleaning of the big office building. And I'm like, well, why don't we just hire somebody? We get like 40 hours and they'll have the best job of their life, and we'll give them, And so we did that. And so, but then the vacuum, we had the equipment already, but then the vacuum broke, this industrial vacuum. So, and since I had done that, I had that team report to me, or that person. And so I went to purchasing, who was like 4 doors down, and I said, you want me just to put this on my credit card, or how do you want me to? We've already picked one out. It's like the same one, but newer. We've repaired it too many times. And purchasing handed me a packet, right? And it had to do with 3 quotes and so forth. And it was, right? So not a bad process. That's wise shopping, right? And this is, I think, how many companies do it. And so that afternoon, we had already picked the vacuum in about 10 minutes of discussion. And it was, I forget, it's in the book, something like $400. And so that afternoon, I'm filling out the paperwork. I'm a little bit annoyed, right? Because I've got stuff I want to do, and like, okay, but and I just thought to myself, $400 vacuum, 2 hours of paperwork. But just that morning, this was before we really had started improving, but just that morning, I had signed our stop loss. We were already self-insured at Merrill Steel. I signed our stop loss agreement without any approvals, for $700,000. Right? And it hit me Why am I not doing the purchasing for that? It's because somehow, this is about every company, I think, so this is not to pick on Merrill Steel or any company, but somehow healthcare, we're viewing benefits as separate and different. Yet at Merrill Steel, it's the third, it still is probably the third largest expense of the whole company. Not HR expense, the third largest expense. And it's absolutely off the radar. And when we hear that we can save 20, 30, 40% off of your third, or in some cases, second highest expense, maybe we should put that on the radar. And you know what? CEOs and business leaders and CFOs and HR folks have these skills, but somehow we're shutting them off, right? So that was the one learning of, let's put it on the radar. And not only is it an opportunity to spend money more wisely, but to make our healthcare better at the same time. Number two, this was interesting. I actually learned this way back in school. I was in the 4-year school, and it was my senior year, and they gave me I was in the psychology department, and they gave me the departmental award. It was mid-year, and then they said, would you have any interest in sitting in this graduate class? It was kind of a little intimidating. I'm like, yeah, I'm going to graduate school, but I'll sit in with the other graduate students. But I took a lot of really good nuggets. So it's called negotiation. And probably the biggest thing that I remember from that and I learned from that was an acronym called BATNA. You ever heard of that? Anybody ever heard of that? It stands for Best Alternative to a Negotiated Agreement. Okay, what does that mean? Very simply put, now I play around. I restore old 40 Chevys and tractors, probably a little too much. My wife tolerates me, is probably the best way to put that. But I buy and sell, and I flip, and I pay for new equipment in the shop and whatever. But there's something that applies to that that's helped me be very good at that, but it applies to every purchase and actually every sale, in that the power of a buyer, here's FMMA language, the power of a buyer and the power of a seller is the ability to walk away, your best alternative to a negotiated agreement. You think about that. Okay, we're going to buy a fishing boat, and I see the one I really want, it's $3,500, but there's two others. Maybe they're $4,000, let's say, right? What is wise for me is I'm talking to the seller of that boat. I'm foolish if I don't let the seller of that boat know I have other options, right? I've got two other ones I'm looking at, and I'm just looking for the best deal. This is all true, is it not? Right? It's not a game, it's all true. But I'm sharing that. In other words, I'm willing to walk away. I am able and willing to walk away. Now, the seller's position might be, right, the same thing. Maybe they're like, I've got 4 in it, and I've got whatever in it, 3,500, and that's it. And I don't need the money. I'm okay financially, right? I'm not trying to stretch for some bills or something. So I'm stuck at 35, or I need to sell. In my head, I need to sell. So I'm coming down. I'm going to get this thing sold, right? That seller's ability to walk away. And so I'm not really fond personally of the term negotiation, by the way. I think I'm more of a trust. Sometimes it happens, don't get me wrong, but when I go to if I were to go to a provider, and I did this with a hospital in Missouri, I would say, just give me really fair prices. Right? Don't give me twice your price. Give me really fair prices. And by the way, I'll know if they're not fair because I have a good idea what it should cost. And then I won't negotiate you down, because 1 year from now, and whatever we agree to, the buyer and seller, we're going to ask ourselves, is this working for me? And if I'm such a great negotiator and I've burned them, right, I leave that negotiation. I sure got them good. That's my partner, by the way, right? But a year later, they're like, this isn't working for us. We're like losing money, or it's just not good. Well, have I won anything if I burned my partner? So I don't want to pay too much, but I want them to give a fair price, and I'm willing to pay a fair price. And then we can be partners instead of adversarial negotiators. And then kind of the take-home point with this is that this was a diagram that's in the book, is that this is how it is today. So as Jay had really articulated well, right, how did we get to networks, and what do networks do? Networks actually prevent our ability to walk away, right? I go to the hospital, and it took 3 months to get in. I got maybe 7 minutes with a physician. I was overcharged. I was billed for things I didn't get. Whatever, right? Lots of hospital frustrations. But I leave there and they say, sorry you had bad service, see you next time, right? We would never do that at a restaurant, right? We were respectful, but we would give the restaurant, if there's 10 restaurants in town, it's like your food's cold or your waiter's rude or your prices are too high. And if you don't fix that, the free market, the power of FME, the power of free market economics is going to make the buyer go to value. And it's the seller's responsibility to be the best they can be. That's the healthy, very natural competition of the free market. But in a monopoly, which is what we have, all that gets shut down. And so that's what we want to open back up by providing an alternative. Now, what we did in Wisconsin, I don't have time to get in it today, but we essentially had juxtaposed, almost from nothing, we built a new health system out of direct care, direct primary care. In 2020, we had 15. Today, there's about 140 DPC clinics. And we did the same with it with specialties, surgery, infusion, imaging, et cetera. The doctors jumped in. When we had buyers, which I think is key, the doctors jumped in. The doctors are just as frustrated in the hospitals. They're wanting to get out, but they need buyers. And so we could spend our time, and this is, I won't get into this either, but we can spend our time trying to fix this, the hospitals or big insurance that it actually is probably protecting the status quo, right? Try to fix something that they won't let us fix, that's not broke for them, or sounds like a big goal, right? But start over and say, let's just build a whole new system out of direct care. And in Wisconsin, we can interrupt or redirect about 95% of that. We even have 24-hour ER in 2 cities, Green Bay and Milwaukee. Naturally, inpatient or something we haven't, but maybe someday, right? So that's the approach I've taken, and many in Wisconsin. So the third one, this was a cold Wisconsin morning at Merrill Steel, and we were just getting kind of going on the healthcare, and I was excited. I don't sleep well anyway, and I don't sit well, and my mind's always going, but I think I woke up around 4:30, and it was like, hey, this is fun stuff ahead. Couldn't sleep, so I'm like, I might as well just get up and shower and go in. So I'm at my desk at like, I don't know, 4:45 or something. And it was one of those mornings, I think it said 27 below on the car, right? Like really cold. But here I am in a shop. The shop's already going at like 4:35 a.m. They're used to early. They're already going. But the office is dark. So I'm by myself, poured myself a cup of coffee, and I sit down. And I don't know what spurred me. This was not highly strategic. I wasn't even awake yet, but I did it. And I wrote my partners on the board. And then the next steps, I sat down and sipping my coffee, and I just said, who can I really trust here? And who is really innovative enough to go forward with me? Because for the year or whatever it was before this, I felt like I was dragging my partners along. I'm like, why is my broker not excited about these things? Why are my partners seemingly resisting me? Paying them, right? And I realized that the only partner that I felt that I put yes next to was the DPC, I think, that I had just brought in, right, naturally. But all the rest, I realized, I'm like, I don't feel like they're with me. They've got different goals, or they've got misaligned compensation, or whatever it may be. And so I realized at that point that I would need to change all of my partners for my health plan, and that's what we did. And that's not easy, right? But I didn't see a way to succeed any other way. So it goes back to trustworthy partners. This is actually a chapter in the book. There's a whole chapter on this. But why would I spend lawyer money, expensive lawyer money, reviewing a contract of maybe one of the big insurance that starts with a B, a U, a C, or an A? Why would I do that? Why would I have to watchdog who's supposed to be working with me? I don't know about you. I'm 52. I'm right, not that old, but I also don't have the energy anymore to drag my partners along or to watch every move. Like when I'm not looking, how about they're doing something good for me instead of sneaking stuff into the contract, right? So that's where the don't feed the beast came from. It's like, man, I can't watch all I need them working with me, not against me. And so that's where that was that realization. So the Meryl Steele story, here we go. This is kind of, again, scratching the surface in the time we have. This was kind of a pioneering. It had a lot to do with what I learned from Jay and Keith. I joined, I think, the free market somewhere around 18 as an FMMA member. And this was just a journey along the way. I did some things out of order. And we had started a healthcare best practice group, as I mentioned, in 18 or 19. But we started with the first step of DPC. And we were able to do it on site. I'm always kind of careful in saying that because near site, I think, is just as effective. So never to think that has to, in fact, on site's much more difficult because you have to fund it yourself where near site is shared, okay? But we were big enough and we remodeled a place right above the lobby to do that, and we built a little clinic. But that was our first step. And I thought, well, we'll try this for a year and let's see how it goes. And I thought it would go well. I thought, but who knows, right? Well, the CFO, who had just passed, I just went to his funeral last week. So, right, life is short. Here we go. It was a good friend of mine. He just passed. He had retired. But he came in after 5 months. We had even started the clinic based on request in a conference room downstairs because we started to share it, right? You got to tell everybody about it. And they're like, can we do this now? I'm like, well, it's not done yet. The clinic's not. Well, okay, we can see people in the okay, let's go. See him in the conference room. But after 5 months, after the first quarter closed, he came in and he said, Matt, we had invested $250,000 for this clinic total to build it, to remodel. And he said, not only have we gotten that back, we've gotten it back and then some. And there were 2 brothers and a sister owner, and the sister I had beside me as an owner. That's one of the things you need buy-in, you need support if you're within a company. She also passed about a year ago. So the 2 people that were most integral in working with me are no longer with us, but their legacy lives on in terms of what they did and what they supported. So the clinic had already paid for itself. It seemed like at that point I kind of had the green light. I still needed to keep in touch, but I didn't have to make big proposals. I was trusted, I was given freedom, and they said, just go do more things. And every step we took had its own return. And I told the owners, I said, as a company of our size, we were about a $5.5 million spend and about 1,000 members in 2 states. They're in 4 states today. They're growing rapidly. But I said, in healthcare, according to and I'm, again, learning along the way. I don't know what I know today. But I said, we're talking in $100,000 increments. Not 1,000, not 10. It's like everything we talk about is in one, right? So we can invest some money and get it back. And so we did. And so one of the next steps, you can see that we had drove to Central Illinois to an ambulance store. And they had, and then I went down with the president. You can see the commitment. He drove with me. And we planned there, we were going to buy, it's kind of funny, we were going to buy one from Chicago. We were looking on the website. We had that one picked out, and it was a bigger one. But it was kind of beat up, and on the dash it said no guns. And then this one is from Iowa, and it was like pristine, and it said no smoking. So we picked this one, and then we wrapped it. Now, learnings. If it worked well until COVID hit, and we kind of parked it, but. If I were to do this again, I would buy a Sprinter. I would not, because we would do this. And we had free, within 30 minutes, we'd go free. The clinic would go free to everyone's house for primary care. You got kids in the winter, you don't want to drag them out. But then they'd say, did you have a heart attack? I saw an ambulance in your driveway. Like, crap. Kind of backfired, right? It's not an ER vehicle. It was just, and we could go into the house and stuff, but small learnings like that. But we had mobile care. MRI. So there were no stationary MRI places in the whole state. However, there's this semi that drove around that still does, that says MRI scanner, very nice inside, but a semi that all the hospitals use, ran by a company called SMS, Shared Medical Services. And they go to the clinics, they go to the hospital, and an MRI, if you buy it there, would cost around, it's gone up a lot, but around $5,000, which Wisconsin is the 4th highest state. And so cost is kind of out of control there. But then our clinic said, why don't we just have them come here? And they won't contract with an employer, but they'll contract with us. We're a clinic. This was a doctor who had left the system, a DPC doc. And we said, okay, but you have to have a 480 plug, and it has to have all these specs, a phone line, and which we never used or anything, right? But all these things on the board. Okay, so it cost us around $14,000 to put that in. And we just had to run it from the back, but that's pretty heavy, right? Wire and so forth. But so again, remember how much we're talking, increments. So I got approval. Okay, do it. I used to be a general contractor. I helped do some of that. We ran it. And I'm sitting in was the second gen owner's president's office. It was right up in the front corner. And I think I had told them about it, but this big semi pulls up, right? It's like, it says MRI scanner on it. And I said, Roger, I said, every time that semi pulls up, you save $4,500. He smiled and he said, I like that. He didn't even know he was self-funded. He didn't even know what that meant. The CFO had done a good job of running all that, right? But I had to teach the owners, here's what self-funding means. You should be paying attention to healthcare. It's your 3rd biggest expense. And I think in a few months, so it could come on a 1-day notice and do 1 MRI. We paid for that, that $14,000 in a couple months or something, right? Investment, return. And guess how much the members paid for that, right? Nothing. How about that? Instead of what would they have paid before? A big deductible. And that was an interesting story because we'd say, and guess how much we paid for that? Around $500. With the plan paid around $500. That's how much the truck was charging the hospital. So still is. But why are they charging $5,000 then for a plug? So I told that story to employees, and right here sometimes we have the quality question, which I think the quality is far better in the independents and the direct care. But it's still a question, like it's almost too good to be true. But here we're talking about the same truck. So if it drives 15 minutes and plugs in somewhere else, it goes from $500 to $5,000. That's an easy one to share, right? And they're like, this is a ripoff. You're right, you're darn right it is, right? And so this is not only how we're gonna give you great health care, but it's how we're gonna manage our premiums, because this year's claims are next year's premium increase. Until we get at the root cause of healthcare, that we're paying too much for healthcare services, it doesn't matter how many are accessible, it doesn't matter if you're self-funded or fully insured, it won't matter. That's one of the root causes. And so that's what we went after. In 2016, Merrill Steel was at 100, they're protecting a good plan. Hadn't unraveled yet, and owners were trying to protect it. $160 a month for family, $40 a month for single. That's where they are today, in the 4th worst state in the nation. It hasn't moved. First year, it took a while to earn the employees' trust. First year was frozen. Second year was frozen. And I told them, I'll get in front of you. We're going to try some things. If it's bad, I'll tell you. I'm kind of, right? I feel like I have a responsibility to you for leading this. Second year, nothing. Third year, I lowered it by $1 just because I could. I don't know what that meant, but that was the year that we really gained, they said, this is real. And we're hearing from all of our uncles and our family members, and everyone else's healthcare is falling apart, and ours is really low. And so that's, I think, where we built trust. They started sending me articles and things. They became passionate about healthcare. I didn't used to be passionate about healthcare either. I didn't even like it. As an HR person, right, as the companies, it's like, get through this and move on. It's boring. And I certainly don't look at it that way anymore. And then many things along the way, right? Step by step by step, everything we did had an ROI, and it made our healthcare, the care better too. It wasn't just about dollars. It always seemed to be better quality, lower cost. And we did that by making direct care a priority. So that was the scope. And then later I left and we co-founded a health plan based on this model called Self-Fund Health, where then my leadership changed to the scope of the state, where then Right, I mentioned we had no imaging. Guess what today? We have the whole state covered with brick and mortar imaging. Who did that? The doctors deserve credit for that. We have the same for infusion, same for surgery, except for one area, et cetera, colonoscopy. So we start filling gaps. We say, where are the gaps and what do we have covered? Today, Wisconsin is on its way. And then wrote the book, and then the scope even kind of became national. So it's still the same approach. So this was a quote I found that I think kind of sums up what I had mentioned, that we can spend our energy, and I'm always open to what works, but we can spend our energy trying to fix the current system that maybe, in my opinion, is maybe too far gone. And every time I try to fix it, they won't let me. Because they're profiting, and right? Who's losing the most? Ironically, the two most key ingredients of healthcare, the doctor and the patient. You'd say the buyer and the seller, and the employer, 80%, employee, 20%, the doctors. How weird is that? Everyone else has got their hand in the cookie jar. So that's why I'm more of the camp of let's juxtapose a new system. Doctors are anxious to do it. We just need buyers. Employers need to restructure their design of their health plan, not only to enable shopping, but to encourage it, right? Because right now, a lot of these direct care, guess what? They're out of network. That's a problem. The network is not really a good thing for us. It's really it's walls around us. Yep. Yeah. So just a couple closing parts here. This is the book. I think we have one we can give away. I could give away this afterward too. But it's over 6,000 out there now, and there's really no money in books, but it's certainly opened a lot of doors for me in sharing this message. And I worked really hard on this, so hopefully you'd find it valuable if you haven't read it. It is on Amazon as well, or I can send you bulk a lot cheaper. And then this one just came out. I wrote this with a doctor from, I think he's from Georgia, right close to the line, but Georgia, Dr. Purcell, who's the co-founder or founder of the DPC Alliance nationally. And this is new enough, and it's kind of a joke. This is like a children's book, but not a children's book. Okay. But the goal is that it explains that if someone were to take 10 minutes and read this, that they would be like excited about DPC. Talks about patient panels. A lot of the things have been talked about already. But that, I think Shane and I think we make collectively like $1.50 or $2 a book total. So there's no money in this. However, we're pricing, and you can buy it in bulk, and I've got some cards. If you buy 20, you can get it for $10 a piece. That's 15 on Amazon, because that's how much they charge. But the thought is that hand this out. Hand this out to people asking about DPC, to anyone who might be interested, because the DPC is the heartbeat of this medical strategy. Direct specialty care is just as important. If we do DPC primary care only, the hospitals smile because we're still referring all the expensive care to them. We need to use like the Veritas surgeries and the surgery centers of Oklahoma and many others. But that's the thought here. And I brought 40 of these with me. So I think you can, I think you can leave if you haven't gotten one. Yeah, and there's one way to reach me. It's also matt@fmma.org is another email to reach me. LinkedIn, you can find me. David knows where to find me, and others, Sheridan. So that's just a small piece of my story, and I am mission-minded. This is not just a job for me. This is really maybe my life's mission the rest of my career, and I want to just leave you with what is essentially the very last section of the book, the Save Your Company book. I've titled it The Future of American Healthcare. The future of healthcare is transparent. The future of healthcare is affordable. The future of healthcare is accessible. The future of healthcare is sustainable. The future of healthcare is understandable. The future of healthcare is relationship-oriented. The future of healthcare is to shop effectively. The future of healthcare is to provide only treatment that is necessary. The future of healthcare is to treat root causes, not just symptoms. The future of healthcare is employers taking fiduciary ownership of their health plan. The future of healthcare doesn't feed the beast who is oppressive and self-serving. The future of healthcare is a positive-sum win-win outcome for all. The future of healthcare is much brighter, and the future of healthcare is in your hands. So that's all I have today, and thank you for your time.